Welcome to Global Dispatches, a podcast about foreign policy and world affairs. I'm your host, Mark Leon Goldberg, editor of UN Dispatch. In this show, we discuss topical foreign policy issues. I have conversations with foreign policy thought leaders and luminaries who discuss their life and career, often with digressions about historic foreign policy events in which their life and career intersected. And we cover often overlooked issues in global affairs. If you want to learn more, visit globaldispatchespodcast.com. And now on with the show. The World Health Organization estimates that around 7 million people die every year from the air they breathe. Air pollution is a major killer around the globe and one that disproportionately affects low and middle income countries. There are two kinds of air pollution. The first is called ambient air pollution, and that is basically the air we breathe when we are outside. The second is called household air pollution, and this air pollution is driven by the use of dirty burning stoves inside the home. The WHO recently released a report putting all the data together around the global burden of both ambient and indoor air pollution, and also what communities around the world are doing to combat it. Here to discuss those findings and the challenge of air pollution more broadly is Dr. Maria Neira, Director of the Department of Public Health, Environment, and Social Determinants of Health at the World Health Organization. We talk through some of the big data and root causes of air pollution around the world and have a longer conversation about global and local strategies to improve air quality in homes and outdoors. I'll post a link to the report on globaldispatchespodcast.com and encourage you to check it out if you want to learn more. As always, feel free to get in touch with me using the contact button on globaldispatchespodcast.com. You can also hit me up on Twitter at Mark L. Goldberg. I love hearing from you guys. I know I say that a lot, but I mean it. Email me anytime. I'll read it. I will get back to you. It might take me a little while, but I do respond to all the emails that I get sent. It's a personal challenge. All right, now here is my conversation with Dr. Maria Neira of the World Health Organization.
Well, it's clear that the levels of air pollution are quite dangerously high in many parts of the world. Whether we should be concerned about that, I think we should take action, and more than be concerned, we need to take actions because we are talking about a major risk for our health. And the solution exists. If we want to put it in positive, we have solutions, and we can take action resulting in very good and positive decrease on these levels of air pollution quite quickly.
And I want to absolutely talk to you about those solutions. But before we get there, can you sketch out the scope of the problem and tell me some of the top line findings of that recent report that your team at the World Health Organization recently released?
Yeah, in fact, last week we launched this report, and it tells us something which is quite dramatic, although more or less in line with what we knew already. 7 million deaths every year, 7 million deaths caused by exposure to the air we breathe, which is polluted. And the other terrible figure is that 9 out of 10 people in the world is right now breathing air that contain a very high level of pollutants. Well, depending where you are, it will be a highest level than in other places, but definitely 90% of the global population breathing air that is not kind of going in line with the standards recommended by the standards for air quality recommended by the World Health Organization is represented a major risk for our health, definitely.
So can you maybe break down some of the numbers for me? First, what parts of the world are most affected by poor air quality?
Well, I think the first message is that we are all affected, obviously at the different levels, but at the moment we have the Southeast Asia and the Western Pacific region where most of the deaths are occurring, followed by Africa and Eastern Mediterranean region. And then in Europe and in North America, we still have in Europe 400,000 dead. So it's something that is affecting everyone and reaching this terrible figure of 7 million deaths that essentially they could be avoided if we take the measures that should be taken.
Can I just ask, how do people die from air pollution?
Okay, the thing is that we are breathing particulate matter that is contained in this air that we are breathing that goes very, very deep in our lungs because there are very small particles and affecting and not only going in our lungs, they go into the cardiovascular system as well. So the diseases that they will be causing are, a stroke, diseases like heart diseases, then obstructive chronic pulmonary diseases for people. Those are very chronic conditions like asthma, for instance, pneumonia in children, and lung cancer. Essentially, those are the ones that are most associated with the exposure to air pollution. We have others as well, but those are the most important ones. Yeah.
And your report disaggregates sort of the sources or kinds of air pollutions that people are exposed to: ambient air pollution on the one hand and indoor air pollution on the other. Can you, I suppose, first explain what ambient air pollution is and what the main sources of that ambient air pollution are?
Yeah, in our report, we are talking about air pollution, and we look at ambient air pollution, which means that what are we breathing outside in cities and urban environments. And then we have the terrible figure of 4.2 million deaths occurring when you live on an urban environment that is polluted and you are breathing that air. But on the other part of the equation, we are looking as well at the household level. So what is the source of energy that almost half of the world population, 3 billion people in the world, they are still using for cooking or for heating their houses or lightening their houses. They don't have the possibility like we have in the most privileged countries that we click in the morning and we have electricity. For those people, their life consists on collecting wood or coal and then on an open fire or without improved stoves, cooking with those very polluted fuels. And that results in a major smoke at home, at the household level, and then you are breathing that and it goes in your lungs and your cardiovascular system and cause major mortality.
Yeah.
So we still, yeah.
Well, I'm saying, anyone who's kind of been to the developing world, has probably seen like around dinner time, just black smoke billowing out the windows of small houses or huts in rural areas. And it's because of that sort of carbon burning that happens inside a small house. On the indoor air pollutions, what sort of mortality rates are there?
Yeah, on the household level, on the indoor air pollution, we have 4.2 million deaths every year. 3.8. If you add it to the 4.2, people would say, well, that represents 8 million. But in fact, we know that part of the pollution that is generated at the household level will contribute to the outdoor, to the ambient air pollution. So that's why we, according to our estimates, at least there is 1 million of overlap. So the total figure will be 7 million and not 8. But you were asking me about the sources. The sources of pollution when you live in a city most of them are coming from transport, from waste management, or from industry, and as well from the way we generate our energy. So if we have very solid fuels or very pollutant sources of energy, of course we will be paying the price with our health on that.
So you're citing a lot of statistics here, but I'm curious to learn how you go about collecting this data, both on ambient air pollution and on indoor air pollution.
Well, we have at the moment in WHO the biggest database on access to fuels at the household level. This is done with a methodology that is internationally recognized. We do surveys, and we have the data from the countries where we work. So this is very much an estimate and the database that is collected in many countries around the world. When we look at cities and outdoor air pollution, the way we collect the data is very interesting. I mean, it's based on ground measurements, so stations that are collecting data on air pollution, but we use as well satellite information. We work with organizations like NASA or the Japanese special agency, and they give us data on air pollution from the satellites. Plus, we add to these two sources, we add a mathematical model. We look at the way that chemical substance in the air will move, and then we extrapolate. I mean, it might sound very complicated, but it's a technology and a methodology that is internationally accepted, and it gives us the best possible information at the moment with the what is available. So it's a very solid estimation of the data. Yeah.
And where are the data gaps in your estimations? Like where are you? Because I know, in a lot of World Health Organization, a lot of UN statistics more broadly, they do apply all these scientific measurements, but yet each report is always, quick to identify sort of gaps in reporting that are generally often the result of the fact that member states don't have the capacity to report certain data. So I'm just sort of curious to know, what do we know that we don't know about air pollution?
Yeah, in fact, in Africa, we are still far away from having monitoring stations as how we would like to see it, as we see in other parts of the world where there are monitoring of air quality stations. We have very little in Africa. We still can calculate it because of the satellite data and the mathematical models and the surveys. But it's true that we need to do a major effort in the cities in Africa to monitor air quality. In other parts of the world, of course, sometimes data is collected at national level. Sometimes it's collected at the city level, and now we have a database of 4,300 cities around the world, for which we, in our report, we provided data and information and estimation of the mortality caused by the sources of pollution. And what we want is to increase that number and multiply it by 10, if possible, soon, and having many cities around the world monitoring data, not because we want to have data, because we know that when data is monitored, then action is taken to reduce those levels of pollution. So it's part of the action that is required to start to do something against air pollution.
And let's talk about more solutions and other actions that are being taken to mitigate this problem. I'm personally more familiar with what's going on in terms of combating indoor air pollution. I'm aware of the work of the Global Alliance for Clean Cook Stoves, which seeks to replace those harmful kind of wood-burning stoves that are sort of ubiquitous in certain places of the world with stoves that burn cleaner fuel. Can you, I guess, talk a little bit about where we stand in terms of replacing those sort of wood and coal burning stoves that are used in poorer places around the world?
There is a big effort in some places to move into providing these clean cook stoves or improved cook stoves. But this is only part of the equation. We need to keep in mind that we need to have access at the household level to clean fuel. So cooking is part of the equation, but then you might have an improved cook stove and still an open fire at home for heating purposes or for lightening purposes. So I think that the solution has to come as well from these improved clean cook stoves, but as well from different sources of energy at the household level, electricity, renewables, LPG, I mean, different sources for this 40% of the global population that is still cook like in the Stone Age in some cases. There are different situations. We need to work at a very global level for making sure that the governments will invest now on this access to clean energy at the international level, because there is this Sustainable Development Goal 7, which is about access to clean sources of energy and sustainable sources of energy. We need to increase access to different technologies and clean fuels in opening markets in Africa, for instance, for people to be able to cook differently, particularly because we know that now the girls are spending hours every day collecting wood or coal in order to cook, and they are not going to school. That's not good. That's dramatic and resulting in the mortality that I described before. Yep.
And on the ambient air pollution, I'm a little less familiar of what's going on around the world to take on this issue. Can you, I guess, describe? I have to imagine that there are examples of countries or cities probably in the developing world who want to do the right thing, who are trying to do the right thing. Can you talk me through examples of cities that are kind of taking progressive action against this threat?
Well, the action will come from different, you need to look at the sources of pollution. So each city will be a little bit different from others. I mean, you cannot compare what's happening in Ulaanbaatar, for instance, where most of the pollution outside comes from the fact that they use very polluted fuels inside the house, and that contribute to the pollution outside. So you need to tackle the cause. And in the major cities around the world, the sources are at least 3 or 4 the most important. One is transport. So the more you can promote a sustainable transport system, a public transport system, which is available, which is cheap, which is responding to the needs of the citizens, and public transport that is using clean fuels, not polluted fuels or polluted cars that will be polluting. So this is one of the pieces of this puzzle that needs to be sorted out.
And I should say, on that front, is not Mexico City doing something pretty interesting to that end?
Yeah, Mexico has been doing very interesting things on reducing the presence of those very old cars, which are very pollutant in the city, or closing to the main city. I mean, the center of the city, the transit of those type of cars. They need to accelerate this type of public transport systems and making sure that people will have better choices and better answers to that. We have many cities around the world that are now committed to remove diesel cars from their cities. This is in Europe, for instance. And at the same time, it's not just removing the cars, it's that you can cycle or you can walk, and that's very positive because that will help us to reduce the obesity levels that we see in our cities, because we cannot walk or do any type of active life, and we are very sedentary. Our lifestyle is very sedentary type. So transport is definitely one of the key pieces that you need to address. Then is the use of energy at the household level. I mean, in your buildings, in your houses, which sources of energy you are using. And of course, moving to a coal-free production of energy would be really good. And then phasing out coal is one of the key answers as well, moving to renewable sources of energy, solar panels or others, but definitely different sources of energy. And then in some places, in big cities in Africa, for instance, they still do the waste management is still done by incineration. So you have a big mountain of waste, you incinerate it, and that generates obviously a combustion and then smoke, and then that contributes to the. In other places, it's because it's the agricultural waste or the agricultural practices around the city. And essentially, those are the most important sources of pollution. And you need to play probably in the 4 most important. If you play only with one, you are missing, an important reduction in pollution. But still, any measure you take, it will have an immediate result. So that is very stimulating.
So are there any other examples, specific examples of cities or around the world that are, doing interesting things, particularly in the developing world, that are taking this issue very seriously and are implementing policies to mitigate ambient air pollution?
Well, you mentioned the example of Mexico City. I think we can talk as well about Chile. They have been doing very good things. You have in Brazil some good examples in some cities, and I think China is one of the biggest examples now. They have declared war on air pollution at the national level. So in Beijing, we see Beijing is still one of the most polluted cities, but until now we were seeing an increase on the trend of air pollution. Now we saw it's stable, that trend, and in some places we can even see a decrease on those levels of pollution. So when you take very strong measures, essentially in China what they are doing is that they are phasing out the use of coal for electricity generation. So that's fossil fuels will be the solution, definitely.
I guess just to conclude, is there anything else that you think people should know about your work and the findings of your recent report? Like what else would you emphasize?
I will invite everyone to have a look at a campaign that we have put it in place few months ago with our partners at the UN Environment, which is called Breathe Life Campaign, because it's very entertaining and it gives you a catalog of ideas. If you are a citizen, what can you do to contribute to reduce air pollution? If you are a mayor, if you are a policymaker, the president of a country, what can you do on the transport sector, on the agricultural, on the energy sector? So I will invite you all to have a look at this. It's in our website, Breathe Life Campaign. And I think you will enjoy it and will provide, hopefully, many answers to people's questions, and will generate more engagement, and hopefully we will all together scale up this fight against air pollution and reduce this dramatic toll on deaths, the 7 million deaths occurring every year.
Well, Dr. Neira, thank you so much for your time and for your research.
Thanks very much. Bye.
All right. Thank you all for listening. Thank you to Dr. Neira. That was helpful. I always appreciate taking a dive into a subject that is a little outside of my wheelhouse. So I appreciated Dr. Neira for taking the time to speak with me. All right. We'll see you all next time. Bye.